I'd like to start by saying thank you to those who have provided the funding for these grants. It's much appreciated. And yeah, so I know we have short time, so I will launch. So back in March, my colleagues and I launched a study that was a prospective longitudinal study that is addressing coping and experiences in the aftermath of the COVID-19, the initiation of the COVID-19 pandemic here. And as you can see here, we started our study within 5 days of President Trump announcing that he was declaring a national emergency. We launched our study by conducting, it's a unique design. This is a survey design, and instead of just collecting data from people all at the same time, we decided to launch our study in 3 consecutive cohorts, each taking about a 10-day period to complete. The first cohort of over 2,100 people was launched between March 18th, on March 18th, and it went till March 28th. The second one was over 2,200 people, March 29 to April 7, and the third one was over 2,100 people, and it went from April 8th to April 18th. A major point I want to make here is that this study was conducted, is being conducted with the NORC AmeriSpeak panel. This is a nationally representative panel that uses probability-based, address-based probability sampling to build the panel. That's one of the things that makes this sample different from pretty much every other major survey study that we know of being done right now, because you don't get to choose to be in the AmeriSpeak panel. You have to be asked to be in it. And so that makes our study truly representative, and it also prevents us from having some of the selection biases that many other samples will have, many of the other, or most of the other studies that we've seen, the survey studies that we've seen being done on COVID-19. So the variables included in our study include things like, and this is a very important factor because this is a characteristic of a lot of our work, we have pre-pandemic mental and physical health diagnoses. These were collected by the panel, by NORC prior to January 1st of 2020. So before they answered any questions for us, we knew we had data on their physical and mental health. We have measures of acute stress, global distress, functional impairment. These are several mental health outcomes. Fears and worries about COVID-19. We've found this is a very important variable that we consider when we look at how people are adjusting over time. We have a variety of exposures to COVID-19, including work-based, direct exposure to the virus itself, media-based, community-based. We have secondary stressors because many people, this pandemic has ushered in a series of secondary stressors that have produced, as we all know, with 38 million plus who have now lost their jobs. People are now dealing with closures of school and homeschooling their children, etc. So these are things that are very important to take into consideration. I don't know what just happened. Sorry. Oh my. Did my screen share stop?
No, it looks good.
No.
Okay, well, it went off for me. Sorry about that. Okay, exposure to conflicting information in media, from government, from various sources, and how much you trust in those sources. We have a measure of loneliness. We are socially isolating. Some people are feeling socially isolated given the, quote, social distancing. We have an important construct that we're looking at, given a lot of my work on time and time perspective. We're looking at perceptions of the future because many of us have a different sense of the future now that we have COVID-19 in front of us. Health protective behaviors. What are people doing to protect themselves and people around them? What's your perceived risk of contracting COVID-19? And we have residential longitude and latitude. which includes region and community characteristics. So we can actually see where they are located and understand what their actual risk is and what might be going on in the community around them as we're looking at some of their data. We're asking questions like, what role does the media exposure play in acute mental health responses, and how might this change over these cohorts over time? And also ultimately, how might the media impact downstream impacts, because we will be collecting more data later. What factors are associated with health protective behaviors and perceptions of risk over time? What are people worried about in the early weeks of COVID-19, and what role does the media play in perhaps shaping some of these worries? What predicts distress among healthcare providers and essential workers who must continue to work in face-to-face with people? And another question is, what role do race, ethnicity, and socioeconomic status play in early responses and health impacts of COVID-19? These are all some of the really important research questions that we intend to address in our study. And so our future plans include submitting a grant application to National Science Foundation to get continued funding. Our grant application will be submitted in August of this year. We have a second wave of data collection planned for just after Labor Day as we start to see schools opening up. This data collection we already have the money for this. This was part of our original RAPID grant. When we submit in August, we're looking for money to continue to pay for follow-up waves 3 through 8 of data collection that we plan to engage in over the next 5 years. As the pandemic waxes and wanes, as vaccines are developed, et cetera. I'd like to point out that our study has been highlighted by the National Science Foundation, by the National Science Board, has highlighted our study in some of their work as one of the leading studies that they have funded in the past couple of months. So we're hoping to get a lot out of this that can help inform policymakers and scientists to understand how we're dealing with this pandemic, and what are some of the factors associated with better or worse mental and physical health consequences over time. So that's a summary of what we're doing. Again, the money that we were given through this grant opportunity is going to support one of our postdocs who will be helping us get many of our papers out. As you can see, we've outlined several of them. We've already developed several papers that we're at various levels of being submitted for publication. So with that, I'll take questions.
Okay, thank you very much.
I have a question.
This is Tali. I have a question.
Yeah, first, I think this is really terrific
Tali?
work. I was just going to say this is really terrific work. So congratulations to this team. Congrats. This is awesome.
Thank you.
What about people's agoraphobia as things start to open up? I don't know about the rest of the audience, but I certainly feel when I walk out my door that I'm just about to be beset by viruses.
That's a very interesting question. Our mental health outcomes are, we have questions about whether people are wearing masks and whether they support people wearing masks. These are things that we're looking at, what the people's attitudes are about the various interventions that are being promoted. And I'm only bringing up the mask issue because that is actually one of the issues that I think that makes some people feel safer in their community when they see a lot of people wearing masks, because then the virus isn't being transmitted as much. In fact, there was a recent article in Vanity Fair suggesting that if 80 to 90% of the population wore masks in public, we would not have the spread of the virus and anywhere close to what we have now. So, we haven't decided to incorporate into our study a question specifically about agoraphobia itself, but we certainly have questions about many of the behaviors that would be indicative of people feeling more comfortable and secure in leaving their homes. So that's a really great question. And one of the things we want to do, and the reason we're going back out in the fall, is because we're trying to understand what are some of the psychological, behavioral, social dynamics that may influence how people deal with a potential increase, again, a second wave of the COVID-19 disease. So
This is
Yeah.
Tom. First, I'd like to compliment you, Alison. This is just really tremendous. Just as a background, I mean, this is one of the few studies that goes from animals where we can control things to human, where the complexity is infinitely larger. So really kudos to you. I have a question, a couple of questions actually. So are these, do you have trajectories? Are you going back to the same people, or are you getting different people every time?
Yes. So we have the first three cohorts are obviously 3 cohorts of different people. So we will be going back to all of those people in our future waves.
Because the complexity that you're dealing with is such that I think there's a good consideration that if you were to be only cross-sectional, you won't be sufficiently powered. The number of variables is such, including things that I may have missed in terms of prevalence of the viral infection, as well as the in a given community, as well as all of the huge diversity of the country. But a trajectory may then, you know, allow you to predict for a given individual what they're going to do in the future and how they're going to respond. And that is, I think, a really, really powerful way of doing it. The only other question is, were you thinking of getting objective measures of stress? Because as you know really well, when people say they're stressed or not, beautiful studies from Lupien in Montreal and others suggesting that there's actually very little correlation between the levels of stress hormones and when people say they're stressed. So is there also an aim to maybe send people swabs or ways to collect saliva so you actually know the objective level of stress?
If we had the money for that, my friend, believe me, we would do it.
Bring it up. Go for it.
Yeah, that's an excellent, excellent, excellent point. I would love to be able to collect that kind of thing. We don't currently anticipate being able to get that kind of money yet, at least not from National Science Foundation, because they typically don't fund those kinds of things in the same way. That is something we would need to apply to NIH for to get that kind of support. But what we do have, and these could be considered more objective forms of stress, is that we do have the GIS data. So we can actually look at where respondents are in relation to various, we've done this before, where we collect data from the community and we look at what's going on in the community around people. So we can see and pick up whether people are in communities that have very high rate cases or very high fatality rates. So we can actually pull those data and analyze that as a more objective measure of, it's not of individual stress, but it's community stress.
Thank you.
Yeah, so that's a fantastic question, one that I would love to pursue. Thank you.
And I have a question, Sadie. Great presentation and fabulous study. Do you have any idea of what percentage of the sample are healthcare providers? And secondly, when you talk about health protective behavior, is it physical, like putting on masks or social distancing, or does it have to do with coping and other kind of strategies as well?
Okay, yes. So the number of, I don't want to get this wrong, but I think the number of healthcare workers in our sample is relative, given it's over 6,500 people, it's relatively small. I believe it's somewhere in the vicinity of about 1,000 people, might be a little less than that. And we are looking at the relationship between, like, what some of the predictors are of the stress in people who are essential workers and we're going to try our best to pull out the healthcare workers. I'm also working with some colleagues to potentially get another grant to look at specifically what's going on in healthcare workers using healthcare, if we can get the money, using healthcare providers from the NORC panel. So AmeriSpeak panel, because they have enough for us to do that. We just need to get more money. The second question, health protective behaviors that we're looking at are actually, what are you doing? Are you washing your hands more frequently? Are you wearing a mask? Are you engaging in the social distancing? So the specific things that people are doing. And we've also included in our study self-efficacy, a measure of self-efficacy, so the degree to which people feel that they are able to do these things, as well as response efficacy, the degree to which people believe that doing these things will actually have a positive effect. So yeah, so we do have those constructs as well. Thank you.
So Alison, 1,000 people would be, is that disproportionate representation of healthcare workers? Or is that?
Ooh. Yeah, I'd have to look at population statistics to answer your question, Suzanne. I'm not 100% sure, to tell you the truth.
And,
Addie, do you happen to know? Do you happen to know what proportion of our actual population is healthcare workers?
Well, we know there's 3.8 million nurses, but I don't know about the physicians or any of the other providers that are out there.
right.
Yeah.
We're out of time. I don't know, Pramod, do you have any comments you wanted to make?
Just what that I think this study was also featured in Science magazine.
Yes. Yes, it was.
So,
Congratulations.
so the National Science Board, Foundation, also the Science. So it was very nice to see. I think it was maybe even the first article Science magazine did on NSF Rapid Awards in this area. And I think this was like the headline of the article. So that was just wonderful to see when it came out. So congratulations.
Thank you.
Pointing that out.
That we have funded 5 more projects. So that just happened yesterday. So we will have more presentations next week. And then there is another set of recommendations that Sid and Ruth's review committee has made to us, and we'll be acting on those shortly. So just great to see all this wonderful research happening across the university.
Yeah, and again, I want to say thank you to you and the committee and the folks who have pulled together to bring the money together to be able to support this kind of our research. It's really special that we had that kind of support from the community.